The hygienist completes scaling and root planing on the upper right quadrant, but before dismissing the patient, the hygienist notices that the posterior teeth continue to bleed. The hygienist completes scaling and root planing and sits the patient up. The patient smiles and the hygienist notices heavy bleeding coming from the area that was previously scaled. This is a dental emergency known as excessive bleeding and can occur after scaling and root planing or an extraction. The hygienist places a gauze in the patient's mouth and asks them to hold it there with pressure. This is because compression is the most effective way to control bleeding. After 2 minutes of compression, the bleeding has stopped. The hygienist takes the blood pressure and temperature, since 2 of the secondary signs of excessive bleeding are hypotension and fever. The vitals are still within normal limits, so now the hygienist reviews the medical history and confirms that the patient is not taking any anticoagulants like warfarin or heparin, nor does the patient have any blood disorders like hemophilia or von Willebrand disease, since these can cause excessive bleeding. The patient assures the hygienist that they do not have any of these, but it is important to note that it is possible that the patient does have a systemic disease and is not aware of it because it has been dormant until induced by trauma. Since the bleeding has stopped, the hygienist will dismiss the patient. But first, the hygienist tells the patient that if bleeding continues for 2 hours, is heavy, or is unaffected by compression, then it is not within the normal limit. They should avoid exercise for 12 to 24 hours, lay with their head elevated, and apply pressure to the area with a gauze. A soaked tea bag can also be placed over the area because teas have tannic acid in them, which may reduce bleeding. Also, if the patient were taking any anticoagulants, they would have had to consult their physician as a preventative measure to adjust or even stop the dosage before today's procedure. Lastly, the patient should contact the office if the site does not respond to treatment, and if they cannot reach the office, they should contact emergency medical services. Excessive bleeding can occur after an extraction or following scaling and root planing. This can occur for several reasons, but it is usually linked to a systemic disease in an at-risk patient, whether the patient is aware of the disease or not. There aren't really types of excessive bleeding, but there are different causes that each have different treatment and prevention methods, so they are almost like different types. First is healthy patients or medically uncompromised. Then there are patients with hemophilia, which is a bleeding disorder that is caused by a deficiency in the clotting factors. There are those with von Willebrand disease, which is very rare but also affects coagulation. Next are patients taking anticoagulants, which would of course inhibit coagulation or clotting. And finally are patients with a hematoma, since this is a pooling of blood, puncturing the tissue would release the blood. The signs and symptoms of excessive bleeding are fairly easy to remember. They include heavy bleeding or a fast flow of blood coming from the scaled area or extraction site that does not respond to compression or continues for 2 or more hours. Secondary signs include fever, lowered blood pressure or hypotension, confusion, or a hematoma formation. It is important to remember that the site of extraction should only produce a mixture of a small amount of blood and saliva called ooze. Treatment methods are different for each cause of excessive bleeding. Uncompromised patients should lay with their head elevated and apply pressure to the area for at least 2 hours using a gauze or tea bag. The patient can bite down as shown in the photo. And tea bags have tannic acid in them, which may help with vasoconstriction. Hemophilia patients have a more intense treatment. The alveolus must be cleaned, packed with gelatin, and then sutured together. Compression is also necessary for 3 days. Patients with von Willebrand disease are a little more tricky. Types 1 and 2 need a drug treatment with desmopressin acetate, which promotes the factor that they're lacking, but a more serious type requires treatment with blood plasma. Continuing with treatment methods, next are those taking anticoagulants. The treatment differs for each drug and often are specific to the individual and require consulting a physician. So warfarin depends on the individual's clotting time, but may include stopping the medication for 48 hours. Heparin may not require any change. Clopidogrel may need to be temporarily discontinued. Dabigatran etexylate and prasugrel may not require change, and finally aspirin may need to be discontinued. Lastly are patients with a hematoma. Treatment includes pressure and applying an ice pack to the area. This could become more serious if expansion continues and the patient would need to be transferred to the hospital. Of course, it would be best to prevent this emergency from occurring instead of treating it, so here are the preventative procedures. Uncompromised, healthy patients should carefully follow all post-operative instructions. Those with hemophilia need clearance from a physician and oral surgeon and may require replacement therapy of a recombinant factor through IV, as well as hemostasis through local anesthesia. Patients with von Willebrand disease have a similar procedure as the treatment, which is a drug treatment, and surgery must be cleared by a physician. Patients taking anticoagulants need to consult a physician, but prevention depends on the specific drug. Hematoma prevention includes careful technique during injection by the clinician.